Earlier, we spoke about spermatogenesis. Now let's focus on oogenesis, which is the creation of oocytes. This figure depicts the path from diploid oogonium, where each female germ cell starts, to haploid ovum, and three polar bodies, where the process ends. So primary oocytes actually begin meiosis I during fetal life and complete meiosis I just prior to ovulation, meaning that between birth and puberty, all of the primary oocytes are arrested in prophase I. After ovulation, the haploid secondary oocyte begins meiosis II. The secondary oocyte is then arrested in meiosis II until fertilization. One mnemonic to remember this by is an egg met a sperm, where met refers to metaphase, i.e. the phase in which the egg is arrested until fertilization. Let's talk about reproductive physiology during pregnancy. Obviously, it all starts with fertilization, which occurs when a sperm meets an egg. This most commonly occurs in the upper end of the fallopian tube, the ampulla, and it generally must occur within 1 day of ovulation, or the egg will no longer be receptive to the sperm. Implantation occurs 6 days after fertilization, and this is when beta-HCG secretion begins. After implantation, beta-HCG can first be detected in the blood around 1 week after conception. It actually takes another week for beta-HCG to be found in the urine, which is why most home pregnancy urine tests will only detect pregnancy about 2 weeks after conception. So, whenever you watch a sappy TV movie and the new parents are screaming for joy because they saw 2 bars on the test strip, keep in mind that the woman's actually been pregnant for at least half a month at that point. During pregnancy, progesterone and estrogen stimulate breast development and increase prolactin synthesis. However, it doesn't make sense for the mom to make milk during pregnancy, so progesterone and estrogen actually inhibit the effects of prolactin at the breast. After birth, these effects diminish as progesterone decreases, relieving inhibition of prolactin secretion and leading to lactation. Additionally, sucking from the neonate stimulates oxytocin release and milk letdown. There's nothing special about suckling per se. Mechanical stimulation of the nipples of any kind will actually increase oxytocin secretion. Another significant hormone, human chorionic gonadotropin, otherwise known as HCG, is synthesized by the syncytiotrophoblasts of the placenta. Levels of HCG increase during the first trimester of pregnancy, functioning somewhat similarly to LH, stimulating the production of progesterone by the corpus luteum and keeping it intact and functioning. You sometimes hear this referred to as beta-HCG rescue of the corpus luteum. HCG helps maintain the pregnancy until estriol and progesterone take over in the second and third trimester. Of course, as previously mentioned, elevation of HCG is also how we detect pregnancy. You can also get a positive pregnancy test in certain pathological states, such as hydatidiform moles, choriocarcinoma, and gestational trophoblastic tumors, in which secretion of HCG is abnormally high. In fact, it's used as a tumor marker for these conditions, so if you see elevated beta-HCG in a man, what should you think of? This may represent a testicular germ cell tumor, which we'll talk about in the next section. So the last thing we're going to talk about in this section is menopause. It describes the cessation of ovarian function and of menstruation after the reproductive years end. It is generally marked by a decrease in estrogen production and preceded by 4 to 5 years of abnormal menstrual cycles, though obviously a woman can be thrown into it immediately if estrogen production suddenly and precipitously plummets, such as if a woman undergoes bilateral oophorectomy for ovarian cancer or another disease. The average age of natural menopause is 51 years, but certain factors can modify this. Smoking, for example, appears to make it happen earlier. Some important biochemical changes to keep in mind are that FSH, LH, and GnRH all go up, secondary to loss of estrogen-negative feedback. This shouldn't be too hard to remember, as it kind of makes logical sense from an endocrinology standpoint. If the primary producing organs stop working, the hypothalamic pituitary axis responsible for stimulating secretion will ramp up. The signs and symptoms of menopause can be summarized by the mnemonic H-havoc: hirsutism, hot flashes, atrophy of the vagina, osteoporosis, and coronary artery disease. The symptoms are pretty frequently discussed in popular media, so maybe this isn't something you'll have to work quite so hard to remember. You may remember I mentioned earlier that smoking can cause early menopause, but you can also see premature menopause with other conditions, such as premature ovarian failure, polycystic ovarian syndrome, endometriosis, and any cancer of the reproductive organs. Basically, anything that causes a sudden drop in estrogen levels.